Chip was diagnosed with schizophrenia when he was very young, when he was about 16. And the family knew very little to try to help him. When Chip first came to live with us, he was 18 years old. He was not going to school, and he was not working. When he got upset, he was very disruptive in the family. He was not interested in anything. He was very withdrawn. The only thing Chip would do in his better times would be to sit on his bed and rock back and forth. His life was a nightmare, and we had tried several hospital programs, but since he didn't have insurance and we couldn't private pay, we were turned away. So I pursued these other avenues. One of the psychiatrists he was going to suggested we try a new center they had opened in Baltimore County, which was to provide mental health services. And they were going to have a day program. So I thought we would try Chip there. And of course we went out to visit Mosaic, and from that day on his life began to change for the better.
Mosaic has helped me out a lot, and I really like the Mosaic. They tell me that they're very proud of me, and I'm doing very, very well, and that's good news for me.
Mosaic Community Services is a behavioral health organization. Our focus is community services. We provide a range of outpatient and community-based treatment programs, rehabilitation programs, all focused on recovery. And what really makes us unique compared to other programs and other services is how comprehensive we are. What you'll see with Mosaic is that the notion of recovery does not mean cure. It means helping people live a satisfying, meaningful life beyond the devastating effects of their mental illness.
Well, I really had 3 goals for Chip when he first came to live with us. And the first goal was a good psychiatrist. The second goal was an effective day program. And the third goal was safe, affordable housing for him. And when he went with Mosaic, I began to see that perhaps these goals might be a possibility for him.
I've learned how to take care of myself. I've learned to make friends instead of not enemies. They've helped me out, you know, getting to know people, living out on my own, and just being a good guy.
One of the things that is tragic about mental illness, and the thing that is something that reflects who we serve, is that it affects everybody. Traditionally, if someone is diagnosed with schizophrenia or a severe mental illness, it's generally at young adulthood. We also, though, treat a lot of children and a lot of families that are struggling from multiple challenges at the same time.
Mosaic has multiple programs serving child and adolescents, from the community to residential. We have a child and adolescent psychiatric rehabilitation program, and we serve children in the community and on site, and the ages are from 5 to 18. We have our independent living program we call our TAY program. TAY stands for our transitional age youth, and we serve kids 17 to 21 and teach them the skills necessary to be able to live independently in the community.
The TAY staff are very real, I call them sometimes, and get their advice and their opinion, because they're always there for somebody to talk to. When I came in a lady, and I see myself leaving as a woman, a mature adult.
I fell into manic depression after 2 of my nephews committed suicide 6 weeks apart. I was unable to get out of bed and just deeply depressed, and I needed medication, proper medication. I was referred to Mosaic to go through a medication program, get a therapist and a psychiatrist, and go through the whole treatment. And since I had worked all of my life, when I felt better, when my illness was under control, I chose to go to the vocational program. I interviewed for other places before I interviewed for Mosaic. They just determined that I was better at a rehab assistance. And the last 5 years I have been a rehab assistant at New Ventures. When I first came, I learned that others had the same problem that I did. I wasn't in this thing alone. So then I teach them that they're not in this thing alone.
One of the things that I always get worried about is the programs that we serve are so critical. We provide the safety net for the community. If we're not here providing programs and services, there aren't a lot of options for many of the consumers we serve.
I've often thought about messages to the staff of Mosaic, and I think the fact that I volunteer might say it all, because I think it's a very dedicated staff. I think it's very important that the top part of the staff is steady and is always there and you can rely on them. The people seem to enjoy the work, and I wonder sometimes if they realize what a difference they're really making in the lives of so many people. It's not just a job.